welcome to another edition or another episode of the Hour of Hope. Thanks for tuning in and joining us today. I'm sure for those of us that watch this show regularly, it will come as a surprise to you that you have a new host. I'm sitting in for Nana Kwame, your host, due to certain situations. Nana couldn't be with us today to facilitate the show, so I'll be sitting in for him as well. I also want to take this opportunity to apologize for last week as we were not able to bring you the show. New BCC and Nafi anticipated, so we couldn't be able to bring you that show last week. But thank God today we are able to meet here. So we are glad that you're joining us today. Pay attention, take your notes, have your questions ready, and then we have our doctor here to answer all of our questions. Yes, so going on to today's activities, we are continuing from last 2 weeks. So we've had subsequent previous talks. We've had part 1, part 2, and then today is going to be part 3, where we have our doctor in the house here. He's going to help us cover the remaining topics and then also answer your questions. Before I introduce my guests to you today, if today is the first time that you're joining us, this is the Hour of Hope. We always meet every Sunday from 7 o'clock to 8:30 p.m. Make it a point to join us every time. Thank you. I have him in the studio now, Dr. Iman Olasey. So, Doctor, how are you doing?
I'm doing great, Kevin. Thank you.
Good to have you with us today again. We've had so many comments and so many, well wishes coming in. Some even wanted you to start a podcast, so I hope you still have that in mind.
Yeah.
Yeah, anytime you want to have it, let me know. I'll help you with the technical setup and everything.
All right, sounds good.
Guy.
All right.
All right, so Doctor, since you're continuing from previous weeks, let us help us with a recap, where we left off last week with regards to adverse events when it comes to medications.
All right. Thank you, Kevin. Nti ene yɛdesua na yɛyɛ no I think sɛ pɛsɛ yɛkaaka yɛn ho kakra nneɛma a yɛkeka ho asɛm ɛyɛ na wɔtwe mmienu a ɛtwa mu no na sɛ wobɛkae a yɛn nkɔmmɔ a me sɛ yɛde wie program no na yɛtwetwe nkɔmmɔ ɛfa ɛyɛ aduro side effect ɛho na mema mo te aseɛ sɛ side effect no actually no ɛyɛ effect of the medication. But because researchers now they did not intend to create that kind of effect in the body, it's not something that they wanted. Almost friend say a side effect, but actually a drone and a cause side effect. Now, using the lock and key model. When Mr. Mokaya show picture of padlock and key. A padlock okay, Ramedasi. Sa lock and key model and I de a draw side effect no emu. Enti sa wo hwe lock na e no ye baby a edru na won no maku ni peduam no baby a ekwa akoye adwuma na me ma munya na ntie se eye sa padlock yi emfa ne se ebi a obi enum painkiller na painkiller no baby a eye adwuma kese eye wadwenem na sa padlock na painkiller no eye so adwuma no enda wadwenem nko a ebi nso ewo oyem. Nti sa ufa painkiller dura baby a padlock no wo bia e betima wura padlock no ma bia no ubenya effect se padlock e wo wadwene no se key no ebia e ma open no ano ebrase but eye padlock na eda wo yem no se edro no ebia e ma wunya constipation. Nti one of the side effects of painkillers constipation. Nti yekeka ne ma bebra betima ma obi etime enya edro eye side effect. The you can't want them back a drone dosage. Nti say doctor prescribe a drone na say dosage no or a mistake or more too much. A bit me am one a draw side effect. So that was one of the things that we talked about. And I might NTC so say a dosage ni bi or the right dosage. But say omo ye a drone no ewo lab na a ye nipa weight omo de determine a drone do also no 70 kilograms. Because omo weigh nipa bebre no ma take average and the number they settled on was 70 kilograms. Into no use sa number no. But yen na inum say nipa yen nam ho ni obi na weigh 70 kilograms. Enti a yara but enye obi na sa dosage no ebia ebeboa no. In fact say so obi nipa ketwa na say the weight very small. Say nipa no be na wo say ni dosage no ye tesoma no say ya nteso a ebetimi ma nipa na side effect.
True.
And another thing I can want someone so wrong administration. Ma eni nya ma munya ntie say enduro bi wo ho no ma so no ma design no untimi ntwam utwam a na why there was say na enduro no say na esi ye adwuma nti enduro bi wo ho a obo say enduro ni din no ER anase SR anase XL say enduro ni say ni nyina na nya enduro a wo so utwam nti say ma wo say enduro no bi na akotwam a ma enduro ni nyina e release one time egu nipaduam a eno betimi amwanya side effect. And say it's a allergic reaction and so eso say nipa ni bi wo ho no ma ne ma bi won duro no ma e no mo nipa duane nje enti omo no mo duro na omo timi nya allergic reaction e ma no so timi mo nya side effect. And ye can synergistic drug interaction and so ho e ma ne nya ntie say e duro no bi wo no ma onom eno nko a o ye okay besa o combine with a duro fufura. And say example use you know Valium and Xanax antidepressants. So we first say draw we be nas on nom alcohol e ka ho a my draw no ye juma e broso bebre etimi ma edin susu so dey e bre nipa no enti e ho e na ye de enkomo twetwe no dey e ba wie ye last 2 weeks no. Yeah.
Okay. Me da say. Na na wo ka say a draw ni a draw bi enhia no. Na mpese mbisa so say edro bi so ni aduane bi so enhia na say edro bi ni fufu enhia na say edro bi ni jollof enhia na.
Yeah, I think say last 2 weeks in the call no so mu kakra say endro no bi wo hono ma etimi ene enduane enso enhia ema say onnimu a ebetimi akoso problem. Me say adro aye de ye example no cholesterol dry friend no statins nti atorvastatin, lovastatin, simvastatin say endro ni nyina say ye do to so na say we will be a otaidi grapefruit and I say grapefruit juice be bra and no etimi interact with cholesterol dro no ema etimi cause side effect enti ye do to adro so anwene bi wo no ma untimi ndi ni bebre and I say ibeka say bi kura mendi nti eno so ewo ho.
Okay. And then yeah, if you be brim Ghana, then I say you ho be train because I say your doctor or have bring doctor na be train. No so in need no nya way into no say na be here say your car yen kan doctor na say e dey na your pepper ni na won hu say e bia ingredients na wo no betimi affect your draw na no kwan bi so.
Sir.
Okay. And that's all right. And then you twice no na say previous episodes no we talked about how you see discover a drew drew and now what church so a drew no so can be so doctors so if I so prescribe and drew na embre ben and I say ko see embre ben na a drew no be over the counter out me cost store na wan kasa a doctor and kind now to me ekofa no so over the counter medication na kwan fa so a drew be than over the counter no but you so with me dey akom kakra
yo me da say I think say yen komo ya twetwe emere etwem no yeah you go over drug development process no yeah. Man for ya aware said that process and a very rigorous and extensive process. It takes a long time enti FDA approve a drone we no a drone about pharmacy shelf so doctor chiro drone ma otimiko na yeah they dispense bi ma enti what happens and say a drone ba and I cover post marketing surveillance ye man for TS say FDA na approve a drone na NC wa omo to so e monitor drone hwe say side effects bi e ba a omo nti man catch na during the clinical trials no and I say are there any positive effects a drone no omo no drone nya e wa bra clinical trials no MP na em say ye the Ozempic examples omo hwe no so mbeka ya enti say FDA a drone ba bonten na say omo monitor sa na say omo hu say a drone no e safe omunya any serious side effects bia after about usually it takes about 12 years and to monitor drone for about 12 years no who say a drone is safer so moka say drone is safer it means say also no a drone bebre pa ansa na etimama any harmful effect that's one of the criteria they look at to approve a drone to become over the counter this a drone FDA approval now it's been on the market for about 12 years. It be more than that. No more monitors are no more say a draw way. If he say ɛyɛ safe yɛde ba over the counter amanfo na sɛ ɔmo de proper directions egu ho sɛ na nipa bɛsi bɛ take no na sɛ ɛnha mo obiara na ɔmo de aba na ɛno no ɛyɛ drug developers no ɔmo develop aduro no wɔn na ɔmo bɛgada data no ɔmo de akɔ FDA no sɛ yɛpɛ sɛ FDA na approve aduro way as over the counter. Why would they do that? One, sɛ aduro no yɛ by prescription nko a it means sɛ obi pɛ sɛ ɔuse aduro no bi a ɔso ɔkɔ doctor hɔ na doctor ɛtwerɛ prescription ma no ansa na ne sɛ ɛtumi aka aduro no yɛn nyinaa nim sɛ obi wɔ hɔ nom a bi a ɔni health insurance nti ne sɛ nti no ɔntumi nkɔ doctor hɔ nom but sɛ aduro no bɛyɛ over the counter saa nipa no will have access to the medication nti from the drug manufacturers ne standpoint no sɛ aduro no bɛyɛ over the counter it means that now a lot of people can have access to the medication which will give them more profit. Nti ɔmo no that's what I guess motivates them to apply for the drug to become over the counter. Nti that's how yenya over the counter aduro no. Once upon a time over the counter aduro no bebree na uhia prescription ansa na wo de ato. But over the time no mo study mu hu sɛ aduro no ɛyɛ safe also be fa bebree pa ansa na aha mo no omo gada sa information nyina na omo de akɔ FDA ni yɛwɔ FDA ni review na so omo fi say yampa then they will grant them the over the counter status na do na free free pharmacy no waba over the counter unhia prescription a obetime de akɔtɔ sa eduro no.
Okay, na maybe say during the process now pharmaceutical companies gather data to provide to the FDA guidelines be the one and I say because then it looks like because from my understanding I say over the counter medication it gives a lot of money. And then most pharmaceutical companies will probably love that angle. Into data gathering process, is there like a I'm not saying organizations be it's not like technically sanctioned by the government, but they monitor pharmaceutical companies and reports. They do what I'm check your data and more.
Yeah, into so-called doctor will not prescribe a drug unya side effect. The doctor would you have to make the doctor aware, and then they will report those side effects to the FDA. The FDA has the MedWatch program. They report to those side effects. Until the drug company cannot circumvent that process, just because someone drew over the counter. And whatever data they call FDA, FDA no review it because there are pharmacists that work there, there are doctors that work there, there are researchers that work there that will validate the information about it to make sure say it's actually true. And some of my approval and be over the counter.
So if say data gathering, we say it can take an average of 12 years. Now me change what you call COVID by within a short period. So data no, I don't say it takes very long. No more gather data. No exception to the rule.
Say COVID nindru nisani manina. Right now there is no medication that has been approved for over-the-counter use. You still have to be under the supervision of a doctor because they've not monitored those drugs for that long of a time. And all the medications somebody treating COVID is all still behind the counter now. You need a prescription from the doctor, and the doctor will have to monitor you before someone submit makasa and drunibi.
Okay. That's it. Okay. And then Kafa we say vitamins to the last time. And also we touch on it kaka whilst we move forward.
Yeah, I think so there was something really important and and I think we left that out, and I want to take the opportunity today to address that one. Kasa about fat soluble vitamins, which is vitamin A, vitamin D, vitamin E, and vitamin K. The one that we did not really touch on, which I think is very important, I was vitamin A, which is retinol. Yes, vitamin A, we say, so you be a 1 year more, you are not supposed to take this vitamin A because it can cause your child to become deformed. And I think that is very, very important information that we need to make people aware. That sometimes vitamins need to be listed and say vitamin A, but they will list it as beta carotene, beta carotene, BETA, and then carotene is CAROTENE, which is also vitamin A. Into you be a what for you need to avoid this kind of vitamin. And yes, akorana be deformed. I just wanted to make sure that people were aware of that one.
Okay. Now, more question be so about over the counter, because that's a program media why you need to say a crew for any no more. Now, your mama and nanom na you feel no na baby ya near friend feature akwati haban. International technically the over the counter because Dr. Jam prescribe. Now, medicine administration, no, say the Dr. Brema ways about federal, so you swallow it and all this. Most of to say, oh, a drone, yes, son. Back room, I say, in this I prescribe a drug, I say, yes, sir. And no, it's saying like a buana as a means of getting medication into your body, no. Say, yes, it is our now call you, and no, is it a dear a buanipa?
Yeah, one of the things we covered earlier on a year, during the clinical trials, they figure out what is the best way to administer the medication. Also, during the many panel oral, also the tar in the skin, and also the tunanuminate dissolve. And during the a very unstable. Into case what the funny pananuma, by the time I'm free, until we take advantage of all the different ways a bit immediately administer a drama will be. You won't be one even Kruman say, they give it rectally. What the best shelter? I said, Topai, now they're shelter. Okay. In your rectum, no, you can't say who knows there are a lot of blood vessels or one sometimes in Drunbo spray no spray no. Same with rectum. There are a lot of blood vessels or rectum. And he said, what they do no a shell to Hosana. And also ultimately bypass it or alimentary canal no e do no core system no very fast. Okay. And in drubi wo hono ma say bia obi ntimi mmere ade na for whatever reason nipa ntimi take a draw oral and no be wo hono ma ometimi dey share nipa ne to. And say if they are trying to get a local effect in the fan say obi a team constipation and they are trying to help the person go to the bathroom, sometimes if they want the results very faster, instead say nipa no be nom na kɔ ne yam to be absorbed and all that, it will take time. Nti no say no metimi dey do na yede afaneto, and then the results will be very immediate.
Yeah, immediate in the because it brings back memories. In Kaipa, na me na Samia. I saw 9 minutes also near who say, "You just na o hwe kraba chakwan."
Yeah.
All right. Now it didn't come more about how drugs are developed for diseases, right? And maybe so say so. What about drugs like that are developed for diseases not caused by microorganisms? Okay. Now, bet us na microorganism brafuno emu yedu kakra. Inti na wacheche mu na fe na watu aso amai.
Yo, me that say. I think say answer na yebeko enunum no eka enyema kakra on the causes of adverse events. Now, me say you cover real quick, and then we can go in there. Okay. Yeah. Still on the causes of adverse events. Another reason a bit me will be any side effect from medication. Say if additivity. So basically, for example, let me read the explanation. So when the effect of two drugs given in combination equals the mathematical summation of their effects when given alone. So basically, aspirin, right, it will blood thinning effect. Until you do be two aspirin, so it means our blood, thin, which means you can bleed easily, right? Okay. And now warfarin, which is Coumadin. Obi a wonya blood clot no de ne to say aduru so se ne be ya ne blood ne be thin na onya blood clot bi em nti aspirin blood thinner and a warfarin enso blood thinner nti se o take say nduru mienu we say eboma the possibility say u be bleed no very high, because aspirin on its own blood thinning effect and a warfarin also on its own blood thinning effect. Into take say nduru mienu boma, the effects will combine, and that's basically additive, right? They are combining the sum of their individual effects, And so that's another reason a bit more be any side effects. For example, we take a draw for ABA, diarrhea. Now we take a draw to help with the diarrhea. Now we for another medication and also to treat diarrhea. It means that any power in it, there's a very high possibility say obenya constipation. Because the point is that when you're diarrhea, you want to come back to normal. But now what Tiki Edrono be bringing to you are crossing the normal to the other side, which is constipation. So that's another reason a bit will be any side effect. Another reason a bit will be any side effect, and so if you know antagonistic effect. Antagonistic effect. Basically, in Dromionua, cancel each other out. What do I mean by that? Warfarin, a blood thinner, is supposed to thin your blood. You cover fat soluble vitamins, vitamin K. It's supposed to help with blood clotting. Until they ought to warfarin, so send a bear blood a bear thin. Now it may bleed easily. And I will take you vitamin K, which will also help you clot blood. And syndrome, you know, and we effect and cancel each other. And he said the amount of warfarin is in a bear when your blood clot, and now you have a high likelihood say it might develop a blood clot because of what taking room, you know, effect and they cancel each other out. And then another one, Rebecca wants them non-selective drugs. Non-selective drugs. You want to be a very selective. If I say beer, so treaty diarrhea. It will only target the diarrhea. No?
Okay.
So in that instance, Rebecca said, "Don't be very selective." And I am a painkiller example. No, the painkiller is supposed to reduce the pain. And selective, I was thinking you brain in corner. But because you're selective, I also targeted the padlocks that are in your stomach, which is causing constipation. And another reason which many side effects here, if say a drone is not selective, which means it targets multiple sites or locations in the body. Now, one example, I remember antibiotics, right? So being an infection here prescribed on antibiotic, what we are trying to do is to kill the bad bacteria and also infection. But the naturally your bacteria help you with digestion and a whole lot of things, right? And it's a be antibiotic. Antibiotic means the bacteria where you're good, where you're bad. It just kills bacteria. And it's a killing bacteria causes infection. It would also end up killing some of the good bacteria in your stomach. And a lot of times, once you prescribe a for antibiotic, they end up with diarrhea. And the reason is that the good bacteria in your stomach that is helping to maintain normal gut function, some of them have been killed or destroyed. And one of the side effects of the antibiotic will be diarrhea. And a lot of times, if prescribe will be antibiotic, I recommend for them to buy probiotics, which are basically the good bacteria. And the drone killing some of the good bacteria, and we are trying to replace the good bacteria with the probiotic. Okay. So that will fall under the non-selective drugs. Antibiotic and it's killing both the good and the bad bacteria. Another very typical example, cancer drugs. And I'm hoping after this explanation, it will make sense as to why being treated for cancer and they get some of the side effects they get. So what is cancer? Cancer is basically a cell that is growing uncontrollably. The way the body grows is that your cells will multiply and divide and then you will grow. But after a certain point, it's supposed to stop when the body achieves what it's looking for. But cancer, a cell, is just growing and growing and growing. It doesn't stop growing. And in order for cells to grow, they need oxygen and blood supply. And the blood supply is what supplies the oxygen. And if you have a cell in the body that is growing uncontrollably, what it's doing is that it's taking the oxygen from the cells around to feed itself, and then it will grow. Eventually, the surrounding cells will start dying. Okay. Until you mobi cancer drug, our goal is to kill every cell that is growing uncontrollably, right? Because cancer cells, that's what they do. They grow uncontrollably. But there are some cells in the body that are also constantly growing. One of them is hair follicles or hair cells. Because we here 2 weeks, no one say because the hair cells are constantly growing. Okay. GI system, no, there is mucus that lines GI system, no, because for example, stomach, there's a lot of acid in your stomach. If there is no lining in your stomach, it means the acid will eat into your skin. Until there is a lot of mucus that it lines your stomach and your whole GI system, no, and that mucus, no, is being made every day, right? Because it's being destroyed and new ones are being made. It is so more be cancer drug, which is supposed to target rapidly growing cells. It will kill the cancer cells, but it will also kill the hair cells because the hair cells are constantly growing. Until most people that are undergoing cancer treatment, no, they lose their hair. That's the reason why. The drug is not selective enough. It's killing every cell that is growing rapidly. Another major side effect they get is like nausea and vomiting because we are destroying the mucus lining in the GI system. So that will fall under the non-selective drugs. Now they are putting a lot of effort into developing cancer drugs that are more selective, which means it will target the cancer cells but not destroy the normal cells of the body that are growing rapidly. Okay. Yeah. And then the last one we will cover for that causes of adverse events will be what we call polypharmacy. And then over for image 23 at 2 screen is umami. Polypharmacy. And basically what polypharmacy is if I say obi enya fever na wako over the counter obeso koto eduro treating the fever no eduro we are na image the screen so na Theraflu to obi nya flu a na wakoto Theraflu no wanom. Okay, so you share active ingredients na obo say acetaminophen ewo ho, which is Tylenol, and it's for pain relief and for fever reduction. And dextromethorphan ewo ho, a cough suppressant, and a phenylephrine, which is a nasal decongestant. Nipa no fever nko na wanya, but okwa na edro we na wakoto. Enti Tylenol no ebe bo na fever no, but enum na aka no oni that sickness no, but onum edro no. Enti he's taking more medication than he needs, and that can be a cause for side effects, which is what we call polypharmacy. To onum edro more than what he is required to treat the disease now or no. It is very important nipa echo over the counter so mokoto edro they treat or area. They need to flip the package and go to the active ingredients, and make sure say whatever disease they are trying to treat, they are not taking more than they need. The fever nko na obese treat it there, then you just need to buy plain Tylenol. You don't need all this extra stuff. Okay. Yeah. And if you have any questions with that, you can always ask the pharmacist. Yeah. This and this are my symptoms. What do you think? Say, yeah.
Okay. Now, more question back. So, yeah. When it comes to the non-selective drugs and the selective drugs, to say a drug or a more side effects, like I say, antibiotic, and then we'll recommend say. Inside the so on J probiotics on count. And it brings my mind back to certain situations. It be back home. So be a sick minty or call doctor or a prescribe your drama. It's my fancy amount of antibiotics, near amount of probiotics or account. But I call drugstore. Sick minty as I selective when I'm top backo, na minya backo. Into sa nipasano, futu bena or mom. And I say in drugis be or it has those two combinations together now.
As of now, I don't know any formulation that combining antibiotic with probiotic. Nipa sana so on to me afford it probiotic now. The bit mine is say yogurt, for example, right? Yogurt has a lot of bacteria in there. That's how they make the yogurt. Is the bacteria is what ferments the waste, And yogurt has a lot of good bacteria in there. So being to me afford it probiotic. Usually I would tell them to try and eat a lot of yogurt while they are taking the antibiotic. If they can't afford the yogurt now, then they will just have to suffer through that diarrhea part. Hopefully by the time they are done with the antibiotic, like it will resolve. Yeah.
Okay. Now yogurt, yeah, can't cap moody and yeah, fine yogurt.
Debbie.
Okay.
Yeah.
Okay. All right. And then today, better also call diseases not caused by microorganisms.
Yeah. I think from the beginning of your teaching, in my yes, answer na omobe develop a drone. also omo study virus and life cycle na omo figure out kwa omo fa so omo etimi target life cycle no baby no dey stop virus no from growing and multiplying. Na question is say na okay say yare no if it's not caused by a virus and as a micro and as a bacteria then omo timi if any edro because you study virus and life cycle and you say you betima target here and say now what if you say yare no is not caused by a virus e won si den no mo fa so motimi den enye eduro nti eno na me pese ye twetwe ho komo kakra na ye mai no so so de clear e ma amanfo nti ye ka say microorganism are basically bi adibia e betimi emfanze mo bi e betimi akoso yare e na ye from say omo ye microorganism nti basically yare a enye mo na de ba no omo de na omotimi de enya anoduro nti no me pese tiefo beta o so na o mai de o ma tie mchechiri mu amede de ebe ma no nti se obi yare na se yare no it's not caused by microorganism. We basically follow the same principle. I will say ye ko nipaduanum na ye hwese ye betimi a study yare no like yare no life cycle e si dan na yare no eba and stages ben na me fa na say yare no e go through and sana itima manifest wo nipaduanum. Nti basically we go back to the lab and try and ask ourselves questions if we can figure out a kwaya yare no e fa so ba na ye hwese ye betimi in stages ye betimi identify stage B ye betimi a stopping na e ma yare ne ma. That's what we usually do. And me per se depression a example just to kind of explain how we come about like depression, because depression is not caused by a virus or a bacteria. And to be depressed they see then itimi enye drodi treating the panema ni pano head a ton. And around the image number 16 beto so mama image number 16 na ye de no astate. Image number 16, the image of the brain. Thank you very much. Okay. Inti depression na nim say area ewo adwenemu. Inti nipa no brain, no, this is how the brain looks like. Inti on the outside, the brain is divided into so many different segments. There is the prefrontal cortex, which is the front side of the brain, okay. And then there is the mid-brain, and then there is the hind brain. The hind brain is at the back, and the mid-brain will be like in the middle of the brain. Until you say, we are looking in from the outside. Until this is the outside of the brain. We are gonna go inside the brain. Into image number 17, we are going to go inside the brain to see what brain inside. Na say under a microscope. This is how things look like. And basically this is a cluster of neurons in the brain. And there are more synapses and neurons in the brain than there are stars in the sky.
Wow.
And it's actually a miracle. It's insane. Yeah, there are more neurons and synapses in the brain than the stars that are in the sky. And again, we are zooming in from outside and we are going into the brain. We looked at the outside of the brain and then we looked on the inside. If we zoom in even further, this is the image of a neuron, okay? And the neurons, a dose will be there are more neurons and synapses than the stars in the sky. And the way they communicate, is like they join to each other, and then that's how they're able to communicate. Ura, go to the next image for me. Okay, so this is the typical structure of a neuron. All right, this is the typical structure of a neuron. This is one neuron, and then there will be another one that will be number 2. So this neuron can communicate with another neuron through what we call a synapse. This will be one neuron, this will be another neuron, and the two usually they are joined end to end like this, and then that's how like this neuron can pass information to this neuron through that way. And let's dig deeper. And now we are going to go inside this neuron. We are going to look at 2 neurons. Image now is what we call the presynaptic neuron. Again, we are looking at 2 neurons. The image on the top is this neuron. We are looking in from top to down. On the top, this is one neuron, and then on the bottom there is another neuron that is joining to the first neuron. And that's what we are looking on the screen right now. The top neuron is called the presynaptic neuron, and at the arrow form, this one is called the postsynaptic neuron. And the two neurons will come together like this, and then there's usually a space in between the two neurons, which is called the presynaptic cleft or the presynaptic space. That's what we are looking at right now. In the instance of depression, usually when the brain wants to communicate, it uses what we call neurotransmitters, which are molecules or chemicals. So the brain communicates using neurotransmitters. Some of the neurotransmitters, one of them is dopamine. So dopamine is a neurotransmitter. And then there is norepinephrine, is also a neurotransmitter. And there is serotonin. Serotonin is also a neurotransmitter. Okay. When we look at the presynaptic neuron, which is neuron, that's where the neurotransmitters are made. And so neurotransmitter now, they are kept in a vesicle, kind of like a ball. When the neurotransmitters are made, it's packaged into a vesicle like a ball. And anytime the brain wants to communicate now, it would release those neurotransmitters, and that's how it will send signal from one neurotransmitter to the other, okay? And in the case of depression, the major neurotransmitter it play a role is serotonin. And serotonin regulates the mood of people. So be happy, so be down, if you are sad. All these emotions are controlled by the neurotransmitters. And between dopamine, norepinephrine, and serotonin, these three neurotransmitters decide if you will be happy, if you will be sad, if you would have energy to focus attention, even sleep. All these things are controlled by these neurotransmitters. And around the image of PET scan at the brain. Okay, very good. And say almost take image of the brain of a normal person will be only depressed. That's the image on the right hand side. You can see there is a lot of brain activity, which is signaled by the yellow sign na ewo brain. Okay. This is a normal person, be only depressed. The brain there's a lot of firing going on, there's a lot of communication going on. But also will be a way depressed. Now you can see there is very, very few activity in the brain. And that is because the neurotransmitters that are responsible for transmitting signals, neurotransmitters, a brain, any body, like obi depressed, there's not enough of those neurotransmitters. We'll go back to that image of the neurotransmitters for me. Yeah, okay. And when they studied this system, and realize obi why depressed, there's not as much activity in the brain because there are not enough neurotransmitters, and then they ask themselves, okay, so how then can we help this person by making sure we increase the amount of neurotransmitters in the synapse, so the brain what coming out of the depression. So what they realized was that one, the presynaptic neuron is synthesizing neurotransmitters, and we already talked about it packages it into a vesicle. And to imagine there is a circle, and it's a triangles be a circles.
Yeah.
Those triangles are neurotransmitters.
Okay.
Okay. And then when say circle a PF neuron and a triangle no to talk space in that two neurons. Okay. It is a triangle a binded to neuron we talked about the lock and key. Okay. And in this instance, triangle a key. And when you treat your neuron also a lock. And it's a triangle a key and a binded to lock now. You will get a response.
Okay.
All right. And it's a neurotransmitter a release good space in the musana. Body naturally a enzyme. If I say ubia kansama yesterday, what's the also go back to normal self. Ukoso stress I mean say what about them? Humanity. Inti quite about the nefaso yes and say after that event that take place enzymes or one a bit break it down neurotransmitters so that action na uye end to one koso sa Into what they realized, and they said once the neurotransmitters are released, there is an enzyme that breaks up the neurotransmitter. Into her image, on the right hand side, most neurotransmitter, no, as I jama yen round, okay. But and we still be a breaking neurotransmitter down there, it sucks it back into the presynaptic neuron, which is neuron I was and then it recycles it. That's what I say. And to be away depressed because the neurotransmitters in the space in the muscle, they've realized, say, okay, what if the enzyme now a yam neurotransmitter? If we can stop the activity of that enzyme, then it means that neurotransmitter can stay in that space longer and help the brain fire more, and that can help get the person out of the depression. So that's one way. Actually, one of the medications of treating depression, it targets that enzyme so that it doesn't break neurotransmitter down. Yes.
It's preventing it from returning, and after when you hunt them, now you keep up with
yeah.
activity. Okay.
Yeah, and that's how one of the depression medications work. Another one also, so what say I do know I am neurotransmitter round on the right side now. On said there is a channel where a room I call back to the presynaptic one and was run. In drone being so one a target is a channel no na a shutting it down. Okay. And the neurotransmitter and send me and go back to the was run, then it stays in the synapse. Once it stays on, it means it can bind to postsynaptic one, paradox now postsynaptic one, so to keep the brain firing. And these are some of the things that we do in the lab. Say disease, and if it's not caused by a microorganism, we have to study. It's called the etiology of the disease. If we can be able to map up the life cycle of that disease and then figure out ways we can intervene. And that's how they will come up with drugs for those kind of diseases not any caused by microorganisms.
Okay. Now, fantastic explanation. And more question back. So with the channel now, it goes back to the presynaptic neuron. If it's closed, is the medication able to regulate when to allow it to open back again? And I say, how long does it shut it? And I say, it's,
Yeah, and that's why a drone, you don't take it one time and you don't take it again. A daily medication. Yeah, because it has time I be shutting it down for. After a drone, on say drone so normal, body after a while it has to get rid of the medication. And I say it has a time a drone by a juma for. The drug will be taken every 6 hours, because after 6 hours, your body will start to eliminate the medication. And yes, it shut down the channel, but it's not permanently. That's why you have to take the medication every day. Until once I don't know where off on a channel, then the next dose you take, will go and shut the channel again. Yeah.
Interesting. Wow. All right. Now, yet also maybe say Dr. Oye pharmacist, what is your role in the prescription and filing process? Pharmacist in the role per air then, because a doctor nana or prescribe na fiber pharmacist or answer na call a patient. What is the role of the pharmacist in the prescription filing process?
Oh, okay, me that say. And I think right now, we are coming out of the more scientific explanations. Now we are coming into the pharmacy, right, and trying to figure out pharmacist. What role does the pharmacist play in this prescription we're seeing? Okay, very good. One thing I'm a for year aware and say a year pharmacist on a doctor they have a 50-50 responsibility. And it means it's a doctor a prescription amount. Nas a pharmacist a fill prescription is a doctor natural no pepe. Nas a BB yawa. The blame is on both the pharmacist and the doctor. Even though senior pharmacists in the prescription, they share the blame 50-50. It is the job of the pharmacist to make sure, say, a drona doctor natural one is the right medication for the disease the doctor is trying to treat. What do I mean by that? Wako doctor honum also over constipation. Na doctor no control drama or control depression draw. It is my responsibility to be able to know, say do we are doctor natural no. It's not meant to treat constipation, but it's meant to treat depression. So that is one of the rules of the pharmacy, is to make sure, say, the medication that has been prescribed by the doctor is for the right condition. So that's one. Another rule that the pharmacist has to ensure, they say, the dose now doctor now are prescribing is the right dose. Inti doctor prescribe a drama akola, na dose or prescribing a penny for dose. It is my responsibility to be able to catch that mistake and fix it. So that's another role the pharmacist is playing. The third role is to make sure, say, the duration of the therapy is appropriate. What do I mean by that? So obi enya infection, usually about 7 to 10 days treatment should be able to get rid of the infection. And so obi enya infection, a doctor threw a drama na a drone for 3 months. It doesn't make any sense. It's the right medication, it's the right dose, but the duration of the therapy is not appropriate, it's not right. And that is also my responsibility to make sure, say, how long I will take a drone for is the right way. That's another way. Another thing is also to make sure, say, quantity na doctor na prescribe is the right quantity. What do I mean by that? I already said, usually to infection between 5 to 10 days. It is obeying an infection. Na doctor throw the right medication, the right dose, the right directions. But quantity now, it will last the person for only 2 days. It means that the infection will not be cleared until the doctor did not prescribe the right quantity to last the patient for how long it would take to treat the disease. Yeah, so that's another responsibility of the pharmacist. The last one I will say, is to make sure, say, the prescription is for the right person. There are sometimes people will bring prescriptions to the pharmacy, not any prescription. So, in that instance, is the right medication, is the right dose, is the right quantity, is the right duration, but not for the right person. Yeah. See, the pharmacists exist to make sure that all these things are done right. So that is one of the major roles the pharmacist plays in this whole prescription process. Yeah.
Okay, that's it. The number question we okay say the pharmacist share 50-50 responsibility with the doctor with a prescription. Going back to the HIPAA regulations where you can share this information, is that an exemption for pharmacists and doctors? They are allowed to share that information, whatever you discuss with your doctor, they have to transfer it to the pharmacy as well?
Yeah, all healthcare professionals are required to be HIPAA trained. Yeah, as long as they are HIPAA trained, they are allowed to handle patients' health information. Yeah, doctors and require so they should be HIPAA trained. Then they can share that information. Anybody in the healthcare network, they are all HIPAA trained, which means we must safeguard patient information. That's why we share information back and forth.
Okay.
Yeah.
Okay, so then that explains to say, Obeko pharmacy CBK CVS akodro. Na say me akaka doctor ni bia manage na so drone ma no pharmacy no e be reading ya away. Sina be say the right medication ya the ma. Okay.
Yeah, we will get into that a little bit towards the end of the discussion.
Okay.
Sometimes they have electronic prescribing, which means wako doctor waka oyare ya kire no oseko Kroger ko CVS ubedru na edru no ewo hodada eno sa no wa ma paper bia wa send the drone electronically. Electronic orders ni bi wo no ma almost 30 diagnosis. So who say, okay, you treat nipa way for otitis media, which is ear infection. And based on that indication, you can then determine the dose and how long and all that. Usually, more paper prescription, it be on for diagnosis, be anxious. So, no answer what they are. If you are trying to clarify anything, then you have to call them and ask them, oh, nipa way the prescription way by now, what are you trying to treat?
Interesting. Now, and not imagine about Bibiso say Ghana no electronic prescription ain't available. I know say they be about there, hopefully. It's natural. It's always been a fascination to me why I was never able to read a doctor's handwriting. is there a secret behind that? Is it because of natural diagnosis? No, sir. Handwriting. And I say, what is the secret behind that? Pharmacists, you'll be able to read this handwriting.
So historically, you know, they did that so that the patients could not. I want to say right now, because some way commercials with TV, so with medications and all that, you know. Obi to me call a doctor, no more doctor and draw on prescribe man. Back in the day, they were trying to avoid those kind of things.
Okay.
And they will write that back no much in Latin, actually. Yeah, until we a pharmacist, you need to learn a little bit of Latin, so maybe a bit to decipher some of these. But it was a way of concealing that information from the patient. So the bear or Kofi Uncle Kanchana down for say me TM, I'm a quite drusin and doctor a trauma and I say yeah. Yeah.
Nice. And the role of a pharmacist when it comes to advocating for patients, you know. Say doctor not try the number. Pharmacist in a review. Say, I deal with the The pharmacist no way allowed so by challenge it. Doctor no or prescription or them a patients and in that situation, who has the final say to overrule that prescription?
Okay, very good. Inti say patient had the prescription ba na me fee say ebia it's not the right prescription for the patient. Already said it's a 50-50 responsibility.
Yeah.
My license is on the line. Inti if I see something, I have to voice my opinion. Inti I have to call the doctor and discuss that with the doctor. Say, what's your prescription? I'm a patient, but me fee say ebia. Say, nema nkwe into Mr. Sister Yenye say. I'll give that option to the doctor. The doctor no ebu funa office I didn't make question now. I have one of two options. In order to protect my license, you know, I can just tell the patient and say, based on this and this and you know, I'm sorry, I mean to me fill a prescription amount. But me call another pharmacy. But then in order to be an advocate for the patient, and I need to tell the patient the reason why in here me feel say mean to me and fill a prescription, because a lot of the patients they are very ignorant and naive.
Yeah.
And that's where that education comes in. I have to educate the patient on actually what is going on. So there have been several instances where patients they've stopped seeing a particular provider because the provider has made a mistake, you know, repeatedly, and we've been able to educate them, say, based on this X, Y, and Z. Now, maybe I will advise you, say, maybe you look for a new doctor. Yeah.
Wow. Because recently, I think a couple of years back, there was issue doctor prescribing pain medication for patients. I think the nurses were like, it's too much, but they couldn't challenge the doctor and indictment. Now, also the Ghana, doctors carry a whole lot of power at our hospitals. We are nursing, you know, say pharmaceutical government hospital in Ghana, and I say being as a nkoya. To me, advocating for my patients need. So that is a problem. I think say how they at least we are fortunate enough say, you know, people can stand up to authority, but it's in Ghana na sade and shada ni hosano, and also ever hygiene.
Yeah, even Hanum say, you know, as a pharmacist, one thing they teach us in school is to, if you didn't document anything, it means it didn't happen. Always document. Whatever conversation that went on between one doctor, you have to document it. And if the doctor bypass what advice, that's a be a patient now. You've covered yourself by documenting exactly what you did. One of my colleagues, not many Juma, there was this patient that was on a lot of opioids and antidepressants, and you know, Xanax, Valium, and then opioids, and he eventually overdosed, and the guy died, right? But every time all the prescription, my friend will call the doctor and let the doctor know, say, and do not what the patient not also know. The guy is at a very high risk for overdose, because he's way above the limit, and the doctor will say, yeah, he's under my care. You know, we are monitoring him and all that. I mean, this went on for several months. And every time the pharmacist is documenting all this stuff, guy no way and the family no issue doctor no, and they were trying to come after the pharmacist too. But because our document is we had to print all that stuff and take it to court. And the judge reviewed and saw said she did her due diligence. And so she was just let go. Because at that point she had done what she was trained to do. And then the doctor had to face the family.
Wow. Interesting. You actually for in a program Nigusu Koso Namaka says, oh, Asembisebia. Ubetumi ede abana Dr. Imawa Hana wajiwa no na number ubetumi afresh sim no yes 646-769-9900 now but passcode 336020 with the hash. Now if you say open say text your contribution so eba ubetumi da WhatsApp ubetumi da 614-822-5359 and after so you can also equally between the questions and the contributions so far social media channels and also our Facebook and YouTube na Dr. Ebeshena where you are not kama. All right. Now yeah to us now be say chroma say your electronic prescription you know. It tell be a mako doctor why be also pharmacy me pay this one was sending bibiako me kwa kodru ono ebu me train cry like just 5-6 hours me kwa na say enye ready na dey so and from him never na ba ne say na edru maybe abako kodru na wo hia edru na no na abako kodru so na say enye ready na wa train so memra be mansa na woko and so betimi actually mu kakra what causes those delays?
Yeah, I think that's a very good question. It's actually one of my headaches. You know, every day I go to work, is dealing with people that are trying to get their medications and it's not ready. Now, there are several reasons I bet me a course sa name. I think say medicam boss say doctor HRO prescription mawa. A responsibility to make sure say the doctor prescribe the right medication for the right disease, the right quantity, the right directions, and all that. Enti, so doctor throw prescription now. Now say any of those is not correct, then it is my responsibility to reach out to the doctor's office and try and get clarification. Now, when we call, you will hardly be able to get a hold of the doctor. A lot of times, a nurse is in a peke phone, and then the nurse not take you a message. A catcher will say, "When doctor Nebekasa," and then I will get back to you. In Tibua, over free and up 8 a.m. Nurse no and get it back to you no, maybe about 4 p.m. and about 5. Because almost no, or busy almost patients. Doctors need they don't have enough staff. Into what they do is they see all their patients and at the end of the day, they will respond to all the clarifications that came. So that will be one of the reasons why sometimes who doctor anopa or prescribe a drama. Pharmacy no say ready because there is a problem with the prescription. We need to speak to the doctor about and get clarification and sign a fairly. But over Fred doctor's office, it's very hard. So when you hold of the doctor and doctor nakasa, also message Emma nurse and on a nurse and then doctor nakokasa, and then she will get back to you. When you nurse, I know now they done so cross one. Some now on the kind of refugee. And this are the no one's afraid. You be afraid 7 times and some of them get it back to you. And it's very, very frustrating. And the reason that this happens is because one, we don't have a centralized electronic system. Uko Europe, for example, they have because of more national health insurance in it, they have a centralized healthcare system. Into doctor and the pharmacy, they all access the same system. It is a prescription about make me pull patient profile. And come on the doctor need make me doctor need notes. But US Hanum say no. Kroger system on con. CVS system on con. Kroger system ni CVS system. Enkasa. Kroger system no doctor's office system. Enkasa. Into the only way to bridge that gap will be to make that phone call. Into Nrobi wo Hanum say ya. Is those based on nipa kidney function. Say I was some failure drone here. I was some timi hu nipa no lab. Who's a kidney function or if it's appropriate for that medication. But I don't have that information. The only way I meet me if I call the doctor and ask them say nipa we none kidney function in lab and say. And that can cause a delay in filling the prescription. And sometimes so electronic prescription is almost send there. Sometimes it can take up to about an hour and send a prescription no a hit a system no. Intino, ako doctor no one was send a prescription ako Kruger.
Yeah.
But yensan ka prescription electronically until after an hour. And two free doctor no one about pharmacy straight over banana be a prescription yensa kura enyankan. It takes a while sometimes and sana hit it pharmacy no electronic system.
Interesting. Intina to say yeah, why for instance Kroger's system ni CVS ni way and communicating. If not for price differences, would you suggest that you stick to one, provider, pharmacy shop, at least your information will be consistent, they can go back and then refer?
Yeah, that is a very, very good question. It will be one of my strongest advice, say, you need to stick to one pharmacy. Why? Say, undrum you know CVS, and I mean, Ewo Kruger. Already, Makase, CVS no Kruger system no and communicate.
Yes,
And he said, doctor, extra prescription eba Kruger. Me minimum say, undrum you know CVS. Ebi a syndrome you know CVS no. E interactive with a drona doctor and their brain, but minim.
Yeah.
Hey, but because say, o feel CVS na minimum into me feel a drona ma. Not knowing say, oh, what room you know CVS. We go for your economy na the problem bro. And he always stick to just one pharmacy. And also an undrong in one place. Pharmacist no pulu profile. Undra u taking in and he say there is any drug interaction. I'll bet you check it and son of the drama. But so who will be with CVS, who will be with Walgreens, who will be with Maya. A drone is spread all over the place. And these computer systems are not communicating into a very high probability say ubeti bon sabeti maka edura ene undro bi enhia ama okonoma mo wanyasem. Yeah, and it's very, very, very important. Always use just one pharmacy. Always.
And that's it.
Yeah. And I think say Ura, so always show image number 8, Amamea. You're still talking about causes of delay in filling a prescription.
Yeah.
And so okay, image in the screen is now. It's a typical Oko doctor Hono Manasi a prescription usually on the more BBTCC. Now, there are key information that needs to be on the prescription in order for the pharmacist to be able to fill it. Into your best start free right hand side, so on you're working your way through. I will say need patients needing a prescription. So. Number 2, I will say patients need date of birth. A prescription. So. I will say a drug or prescribe a drone needing a prescription. So. On the left hand side, there is the medication. Okay. And the dose of the medication has to be on the prescription. There are so many times, doctor bet your prescription or trade drone dose be account. Mean to me feel it. Unless I call them to clarify, okay, Drew, in dose when I was all the man. And then I will say direction, our prescription. So saying I was a patient and take care drone. What I do here, I will say 1 tab, which means 1 tablet. PO means by mouth. And then the QHS means at bedtime. So Dr. Ne catch me say the patient is supposed to take 1 tablet by mouth every night at bedtime. Yeah. So Otro say take 1 tablet as needed. How many times a day na take a drone? We need to know. Because technically so prescribe 100 and even we're not taking 100 pills in one day because also take as needed. And to wait take all the 100 in one day. So they have to be specific and tell me say every 4 hours, once a day, every 2 hours. So as needed there, then also the maximum number of tablets and if take in a day, or say take 1 tablet by mouth as needed, maximum 3 tablets a day. That means any don't taking more than 3 tablets a day. And I will say or the quantity extra prescription. So sign and amend dispense nipano. Dr. Bitmatro prescription, Tylenol 500 milligrams, 1 tablet every 6 hours. One fact, do amend dispense anxious. So patients na me man 100, me man 400, me man 300. I don't know. Until I mean to me fill a prescription unless I call the doctor and he tells me how many tablets to dispense. Okay. And that number of refills. Just 1-time prescription. And now say nipano obitima fill in 2 or 3 or 4 times. I will say doctor no edesheso. Okay. And I also the date who patient no so esheso. Na or sign prescription. No, there are so many times that be our prescription is so, but doctor no and sign. Anybody can take a piece of paper and write all this information on there. It is the signature that authorizes us to dispense the prescription. And it's a doctor now for the signature anxious what prescription no, basically is invalid. I can't do anything. And these are the things that would usually have to be on the prescription. It is all called doctor office or not or more paper prescription. You need to check and make sure say at the bare minimum these things are on there. Because if any of these things are missing, what that means is all the prescription local pharmacy here, they will not be able to fill it unless they get a hold of the doctor. A lot of times what we see is, especially on Friday, most doctors' offices, they are closed on the weekend. Ubiako, doctor on Friday, any amount of prescription. Unfortunately, maybe for quantity and so now we have to wait Friday, Saturday, Sunday, Monday, and Sunday to my friend doctor. Then the pain is going all that weekend, without the pain, and the person is going through the pain. And so doctor normal prescription at the bare minimum you can check and make sure say all this information is filled out. Then you are guaranteed so the pharmacy is one of my on bit my fill ya mama. Until you call image number 9 no mommy. Okay. Until we prescription a doctor a trauma patient. So what patient needing so amando and an address the age and a date we were my age, but my date of birth, right? But the numpo the maybe sa patient and now watch rashes. That is allowed, okay? And a drona watch on amoxicillin 500 milligrams or see and dispense 21. And say directions or say 1 cup, which means 1 capsule.
1 capsule
3 times a day for 7 days. Now, what say doctors need from your pharmacy school. You ensure how to read doctors' handwriting. Until the mechanic say, and then many people more they teach us like the abbreviations now on 1 cup times 3 those. But if I can read to figure out say where 1 cup and and she said doctor my prescription now so who her prescription I want to mean there might be a high possibility that pharmacists knows want to mean and to check and make sure so at the bare minimum you know what medication they gave you. And they told you how you need to take it. Because there are sometimes a Friday, a antibiotic, nipa no infection. Only me 3 days without any treatment. And to make my catcher say, doctor no, one for directions and go so. And answer directions no any clear. No be so. Or catcher or quite over so I will take care druna or say or casamin taking the say. I can take your word and fill the prescription. And then Monday no, just call the doctor to confirm. But here's the case that you have no idea what they give you. And I can't help you. Until the mechanic says the doctor drop prescription at least. Be say drobe na watchra mami na sign and na me taking no. Na make you sure so at least wait me read the whole paper no. Yeah. There are a lot of times patients can read, we can read because that's what we do every day.
Yeah.
But some of the doctors are so bad of a handwriting say you can't make out the head and tail of the prescription.
Doctor's handwriting.
Handwriting is very terrible. Yeah.
Okay. Now, going back to the prescription form, I saw the first one. It was now a journal. You take it at night time. And person who say, does the hour of the day, period in the day, can have any significance on how the medicine affects the person?
Yes, sometimes it does. Okay, typical example, cholesterol medications. Most cholesterol medications, they will tell you to take it at night. And the reason being that when you go to sleep, that's when your body makes cholesterol. So the best time to take the medication is at night while the body is making the cholesterol. So the adrenaline will have the most effect. Yes. And adrenaline be one of my cause drowsiness, which means it makes you sleepy. To imagine it says you're more taking an 8 a.m. Now it means the whole day you'll be sleepy, you can't function. So the best time to take a medication like that, will be at bedtime. And so that's the reason why sometimes they don't know about taking an opioid taking a numeric, especially dry also drowsiness. And a lot of times they will let you take it in the evening while you are going to sleep.
Because usually now, for instance, cold and cough and drone, If you have the same medication or your AM and your PM. To no one can match that a ingredient such a way said, or maybe a drowsiness partner free AM denim na PM denim then it's a bit me a boss more to me other.
Yeah, very good. So basically, the major difference between that AM and PM medications, PM medications, they add Benadryl. They add Benadryl. Benadryl, take Benadryl, it makes you really drowsy and sleepy. And they add the Benadryl to the PM one to help you sleep. That's the difference.
Okay.
Other than that, the active ingredient is the same, but the PM one, they add Benadryl to it to make you drowsy so it can help you sleep. Yeah.
Okay. Now, another question about expiration dates when it comes to medicine. Oko store in the so best before. Just the best before, and so who didn't before start dating the outer tasting the fire. After start dating the not tasting the sweaty. Now, when it comes to medication, so expiration dates now, what is the best practice? Say time now so they already dating now, men for cry and I say, oh, leeway before 2 days, you're to me. I expire 2-3 days, and I want to go to me and your face, and the same week. And I know it's medicine expiration dates in the same or fun, and so and then information it's
that's a really good question. And it depends on the type of medication, but generally speaking, right, most of the medications now you take you over the counter or we say when the expiration date hits, if I say during the expiration date here, October 28th, 2023, which is today. After the expiration date, within the next 6 months, typically, a drone will lose about 10% of its potency.
Okay.
Yeah. And before Sebe expire, a drone is 100% effective. After say a drone expire, from the day na a drone be expire, within the next 6 months after that, a drone start to lose 10% of its effectiveness. Until Uber drone, it might not harm you, but it will not be as effective as when na expire. And then a year later, it will lose about 60 to 50% of its effectiveness. Yeah.
That's it. Now, more question also about refills. So, me, for instance, my hospital, me drew for CVS. My and I keep getting text messages from CVS for refills. So I'm like, Dr. Nenka said, I'm refill, and I said, I'm call back. So why are they still asking me for refills? And which me I check my secretary with them, yes, and I some more rights to keep asking me to come back for refill when Dr. Nenka said, major refill.
Yeah, it's a very good question. So, it depends on the kind of medication, right?
Okay.
There are some diseases or you are expected to take the medication on an ongoing basis, right? I don't know, disease, it doesn't have a cure. For example, so high blood pressure, it is expected so we take it every day continuously. And a lot of times they will ask you if you want to put the medication on auto refill. Normally, there are 2 auto refill amount. They are trying to help you so you don't go without the medication, because you get the most benefit if you keep taking the medication without any gaps in between. Obi one more filling a draw for 1 month. Na draw for 7 days on umbi. And son was a picky a draw of UBM. When you have those gaps in there now, it doesn't help you get the full benefit. So the pharmacy is trying to make sure you don't have any gaps in your therapy. But a draw being so one man, Obenum Eco Drew baby, maybe a doctor Nasano. And I say you've decided to be a unknown beam, but doctor not sure the refills too. So from our standpoint, we are expecting say you will keep taking the medication until the refills are done. And we will do everything we can to help you to make sure say you are not having gaps in your therapy. That's why they do that. And is to help patients to be adherent to omo medication and to be able to take it continually without any gaps in between. Yeah. And to say ubia own person ubenya messages now, you can always opt out. Say I don't want you guys to text me when my prescriptions are ready, they can take you out. But some of them is default. Unless you tell them you don't want it, they automatically enroll you to try and make sure say you are taking the medication without any delay in the therapy. Yeah.
Okay, that's it. Now, more question about name brand and then generic. so fine idea, name brand, kasi be no boy and I can say papa. Instead the bedroom so name brand boarding, sing generic one. Doesn't mean say name brand near papa sing generic nana. So maybe will be qua a castle generic or a be air for but to say air for the anna case and papa my uncle name brand and boarding, potential difference so much and I say just tag keke.
Yeah, and I think we talked a little bit about it. So more approve medication when they go through the clinical trials and the medication gets approved, company they are given exclusive rights to sell the medication for 20 years. Into that 20 years, no be anti-mania drone be. Into that adrono is just the brand name because that's how they're able to make recover the investment. But after the 20 years has elapsed, now people can start making the medication, and that's when the generics come on the market. And from a drug development standpoint, the brand name and the generic, usually it should do the same work. There are very few medications where the brand name and the generic might not produce the same effect, but it's very, very, very few. But for the probably 99% of the drugs in the brand name and the generic is supposed to produce the same effect.
Yeah, because a lot of times, be a call, and I use CVS as an example because I want to meta Edimedro. Over na brand name is here, na CVS brand is here, no madani share active ingredients. No, it's the same thing. I'm like, okay, so I get confused. And then what is making this expensive? Is there some secret ingredients in this one? But it's just the same thing, just that they have to recoup their investment into. Okay.
Yeah.
Wow. Now I have another question too about insurance. American insurance is very, very, very complicated because sometimes if you are surgery grandpa, you have to pre-clear certain medications in your with the insurance company or more approve and sana even go ahead with the surgery. In the prescription as well, sa clearance na there and also it was a medication side no so biana.
Yeah, actually there is. For image number 26, my two screen is mommy. Why? Is that the image 26? Okay, then I think that is not it. Is that one right there? Okay, thank you. Okay, right. Okay. And this image na that screen is now, right? It's basically the pharmaceutical drug supply chain, right? And where at the top there is the drug manufacturer into right? And then they would the wholesalers and then the government distributors would purchase the drugs from the drug manufacturer, right? And those are the people that will supply the medications to the pharmacy, the doctor's office, the hospitals, right? And that's how the patient will get the medication. If you look on the left-hand side, they are the people that pay for the medications. So you can see the government is there, the employees, and then the insurance companies. Now, where I want us to pay attention here, between the payers and the other sides, right? Mm-hmm. There is this guy there, and they call it the pharmacy benefit manager, right? So those are the PBMs. The insurance companies, they hire these people to have oversight over the prescription, the prescribing process. So basically, there are so many medications to treat hypertension. There are so many medications to treat diabetes. The insurance company, they have to decide, say, okay, which of these medications are we going to cover? Because, for example, brand name drugs are expensive, generic drugs are not. There are brand name drugs that treat hypertension. Any what generic drugs they treat hypertension. And if the doctor prescribe a brand name drug, does it mean we have to pay for it? And it is the PBM will be the ones that will make that decision. And what they do sometimes is they can have direct contracts with like the wholesalers, right? And they have a better price of a medication. For example, you use metformin. Okay. PBM ebi Cardinal Health. Cardinal Health is a wholesaler. Almost a drug-free drug manufacturer. I want to supply to pharmacies. Nti PBM no contact Cardinal Health, and a Cardinal Health catcher almost say for each bottle of metformin, you the amount maybe $1.20. And that metformin, let's say, is made by Pfizer. Moderna for us, maybe almost metformin. Okay. Because so many better deal from Cardinal with Pfizer, Nontino. So doctor, Ecotro metformin amount, and the pharmacy is trying to dispense Moderna brand of metformin, which is maybe very expensive. The PBM will say we will not pay for that one because we have a better price with Pfizer. Intino, let your doctor and as a pharmacy dispense the Pfizer one before we will pay for it. And they make a lot of these decisions based on research and clinical guidelines. Clinical guidelines, it guides the doctors, how to treat a disease. For example, some person who treat hypertension, the clinical guidelines, will walk them through what to do. Until that image now it also before this one it also mommy, and then we'll review that one real quick. Okay, this one right here. So where a clinical guideline our doctors follow to treat all hypertension. Until say top left corner it says hypertension with type 2 diabetes. Until say doctor now hypertension. That's also our diabetes. They will follow this flow chart to decide what kind of medication or whatever amount. Into flow chart and it says will hypertension or type 2 diabetes. Step 1 I say you prescribe no ACE or ARB. Into ACE, a drone be a folly under ACE inhibitors and a lisinopril, right? And a drone be a folly under ARB no a losartan. Into based on this flow chart and the doctor will decide so be prescribe or a lisinopril based on this clinical guideline. The PBMs, they also have access to these clinical guidelines. Into ubia kone doctor or hypertension or type 2 diabetes. Clinical guideline is say a prescriber no lisinopril and as losartan. Now doctor call prescriber a water pill to say hydrochlorothiazide. Then the PBM would then question say per the clinical guideline the doctor is supposed to prescribe you either lisinopril or losartan. I then call prescriber hydrochlorothiazide. Until also doctor will explain the reason why. And if we feel like say that explanation is valid, then we will approve the medication. So these are some of the reasons why sometimes a doctor prescribe a drug or insurance and they say main cover and I say here prior authorization and sana
delay.
All these things will cause delay in filling the prescription because sometimes by the time our doctor have contact to insurance, a fax paperwork a crow here a common maybe it's been 2 days, 3 days, 5 days. Not still watching insurance. These are the reasons why a lot of times we are once a doctor prescribe a drug, insurance is ready. Insurance is cover. These could be some of the reasons why. Every disease they have clinical guidelines that guide the doctors as to how to treat the disease. And if the doctor violates the clinical guidelines, then questions arise.
Okay. Medasi. I'm saying your question be by. Yeah. Bisa say, is it good to take blood pressure medication at bedtime?
Okay. That question, it will depend on the type of high blood pressure. There are so many different types of high blood pressure. Okay. There is one we call essential hypertension. There is idiopathic hypertension. Basically means we don't know the cause of the hypertension. And there is natural hypertension. You only penny be one more blood pressure. When they are awake, they are fine.
Okay.
Only when they sleep, more blood pressure. They will have you take your blood pressure medication in the evening because that's when your blood pressure goes up. And if you have just essential hypertension, which will be like the regular hypertension, then it doesn't really matter what time of the day you take the medication. You can take it in the morning or you can take it in the evening. But you'll be a nocturnal hypertension, then you are necessitated to take the medication in the evening because that's when you need the help the most. Yeah.
Okay. Yeah, that's it. All right. Thanks, Emreno. Yes. Now, once to be brave, and see, if I say, bit me a training in Apricana, say, yet another.
We are planning on finishing tonight.
Okay.
I think we will try. They can also, so we'll try and power through it.
Okay. Yeah. All right. Then maybe move your call future of healthcare.
Yeah.
As to say medication, it be as future say things are changing, and so medication on it be now no yeah no generalized, it be no be like customized, personalized to fit individuals. No? And see, when it comes to the future of healthcare now, between the FM real quick now.
Yeah, there is a lot is changing and it's changing really fast. And I believe the future of healthcare now will be personalized medicine, right?
Okay.
It's not going to be generalized anymore, one size fits all. We are coming out of that era. Everything is going to be personalized now. Because of the Human Genome Project, now they've been able to sequence like the whole human DNA. And now there are a lot of companies that are popping up that can, let you know your DNA makeup, right? There's Ancestry.com, there's 23andMe. There are so many of these companies they will be able to give you your genetic makeup. I think last week we talked about the fact that even being from different races, it gives us different variations in how our enzymes work. And you can say, Obi or free Ethiopia, those people, they metabolize pain medications very fast. Into the normal dose, I will be another more juma. I feel like we are heading in the direction when you go to your doctor's office, they will do a genetic testing on you. Depending on what disease you have, they will get a clear picture of the enzymes that are involved in the drugs to determine, say, okay, nipa way, is he a fast metabolizer? Is he a slow metabolizer? Is he an ultra metabolizer? And based on that information, then they will be able to dose you based on what type of enzyme you have. And I believe that is where healthcare is heading now. And if you go to a lot of institutions now, they have genetic counselors there now that would like counsel you based on your genetic makeup. And depression is one disease state that we know genetics play a huge role. They are treatment resistant. They are not responding to it. Until now, some of the depressions, they will have you go do a genetic test, and based on the outcome, that will guide them as to how to treat you. And I think that's where the future of healthcare is going. In regards to the medical profession and the pharmacy profession, I think in the future, now this is how things are supposed to go. When you are sick, you go to your doctor, you tell them the issues you have, and then they will diagnose you, say be hypertension or diabetes. And then what they will do from there is they will refer you to go see a pharmacist. And then the pharmacist will decide what medication to give you and what dose to give you. That should be the proper way that we are supposed to be practicing medicine in this day and age, because the doctors are trained to diagnose disease and the pharmacists are trained on medications and how to dose it.
So it's like the other way around.
Yeah, and it would only make sense the doctors will focus on what they are trained to do and then allow the pharmacists to also focus on what they are trained to do. Until you go to your doctor's office, they will diagnose you and then they will refer you to the pharmacist who will decide a draw crowd or better so how much or they amount, and then also monitor you in case of any side effects. I believe that is where medicine has to go, and I'm hoping eventually we will get there. We are not there yet. There are a lot of challenges, but I'm hoping eventually the doctors will come to that realization and we will head in that direction.
Okay. Now, with everything, customization, personalization is expensive as compared to general stuff. It's really good hearing healthcare medication will go that route, but wouldn't that make it healthcare more expensive? Say a customizable treatment to suggest you into certain things that wouldn't have been in consideration. Now they have to consider, and wouldn't it make healthcare more expensive in the future?
I think initially, it might be expensive. But as the technology grows and expands and competition comes in, it's going to drive, the price down. If you look at the EV car market now, it was just only Tesla for a long time, and now different companies are coming in and it's driving the price down, rapidly. Initially, in India, I think say we might have, stumbling blocks, but as the technology evolves and now with the introduction of AI, hopefully, more people will come in, and once there's competition, hopefully the prices, will start dropping. Yeah, I feel like we don't have a choice. That's where we have to go if we want to make the most impact. Yeah.
Okay. Yeah, and then as we a car Kroger CVS some say systems so any integrated so in the future so we can head that direction as well.
Yeah, I feel like say in the future we will probably need to have a centralized electronic record where regardless of where you go, they all access the same information, because as of now, even if you change primary care doctors, right? Let's say OSU, and I will change it from OSU to Ohio Health, right? You will have to request for all your medical information to be transferred from Ohio State to Riverside because they are not using the same system. Wow. But in the future, if we have the same electronic medical record, regardless of where you go, they are all accessing the same information, which will make healthcare very streamlined. Another issue is if you have a primary care doctor or dermatologist or psychiatrist or cardiologist, they are all not integrated, right? Ubia have access to only the information they have. Into your primary care doctor, what your psychiatrist is doing. Your psychiatrist, what your cardiologist is doing. But if here's the case, we have a centralized electronic recorder, then they will all be able to see the same thing and they'll be able to get a bigger picture of what is going on. A lot of the issues that happen in healthcare is as a result of this very issue we are talking about, because everything is in silos. Your primary care doctor has no idea what your cardiologist is doing. A lot of times there are patients that will come in and they are on multiple medications that treat the same condition. Need doctor prescribe metformin. Once maybe a cardiologist will prescribe another drug for diabetes, but they are not communicating. The primary care doctor names we are prescribing way. And yes, the pharmacist and the I detect this we are. Then he's taking multiple medications and any clients will take it.
Wow, that's a huge disadvantage there, because ABR now, a primary doctor, you really like the person, that doctor is very good, and then a cardiologist and see a very good, but more different network, it's now quite a challenge.
Yeah.
So I guess advice and say as much as possible, if you can, stay within the same
network. Yes. If you Ohio State, make sure ABR, your primary care doctor is Ohio State, or any specialists that they are also within the network. I understand that sometimes the insurance companies will not pay for you to see a doctor in that same network and they prefer somebody else. But if they will allow it there, then it's better for you to stay in the same network. Or primary care doctor at Ohio State, or cardiologist at Ohio State, or psychiatrist at Ohio State, at least within that system, they are using the same electronic record until they can share information easily between themselves. Yeah.
Yeah, because I've seen like Ohio State, for instance, uses the My Chat.
Yeah.
And then also it's questions that I want to bring up and encourage other people to, because a lot of times, all the hospitals, doctor no trouble, everything is documented. But you might not remember everything from previous years. But I would encourage, we use those apps, My Chat, for instance, and I think Nationwide also has one, but the one that I know much of is the My Chats. You can always download that app, log in, more information, so you can also track your medications, and then maybe I'll call different hospitals and say, unya opportunity to let them send it over to you. You can have access to My Chat, and then they can review it and see your previous medications are all.
Yeah, I think that is a huge breakthrough, and I was very excited when I realized they are doing that now. Before, Oko doctor when you PA outside now bar, you didn't even have access to your own information.
Yeah.
Everything was kept secret from you. But what the My Chat has done is you have access to all your medical records in your hand.
Yeah.
If you have the My Chat app now, you can go in there, you can look at your labs, you can look at your medications, you can look at the after visit summary, what the doctor said.
Yeah.
Because sometimes maybe even a commoner could and a doctor not document was chatting, but you have no idea.
Yeah.
But this time around, you can go in there and make sure saying commoner moody, and that's what was documented in there. And then with medication, so call another doctor need be so you can just pull it up real quick on My Chat. And that is a major breakthrough, and I think people should take advantage of that.
Yeah.
First, so call laba, and no one say catch us see the actual values, but this time around, once you log in, you can
even
see everything.
your X-ray cry. You can see your X-ray pictures and everything on there, which is,
I think that's a major breakthrough.
Yeah, that's very good. All right, thank you, doctor. Now finishing up on AFUTU guidelines, encouragements, any tips that you have for viewers.
Yeah, and I think say the additional every and I hope say it has been a blessing to our viewers, and they can also share it to their family and friends, and help them in any way that they can. Bringing everything to a conclusion, these are the few things that I would like to say. Say, Dr. Etro Edrumawa, never stop the medication by yourself without letting your doctor know. Say, what jay edro. Why am I saying this? Because and yet drew be now wait me join a precope. And drone be home, they'll so for some time. Say decision no basa or say you free so or say gradually no matter take you off. Ujine or precope wait me withdrawal symptoms. For example, pain medications, opioids. We all know about the opioid epidemic. When you go on it for a very long time, sometimes they will have to gradually taper you off. Some of the depression medications, you need to gradually come off. Give your body enough time to readjust itself. And to never stop taking your medication without consulting your doctor. I would not advise that. So that's one advice I would like to give to people. Also, said what to address one, never wait to run out of your medication before you request for a refill.
Yeah.
Say your 30-day supply of medication. Oh no mana esa no who say do no esa. Say account tablets 4 no for phone no for pharmacy. Say me tablets na ka phone to me say me request for refill. Why am I saying this? Obi timi twan na edru no asa. Afa no afre pharmacy say me edru asa me hia bi. Time na obo free no. Ebi na a Friday edru no is not in stock or say order. Inti embedru until Monday. So now you are going to go for 3 days without medication.
Yeah, if you cramp on the back
order. Yeah. Exactly. Yeah, COVID iba I say no. Inactive ingredients no no be more craft from overseas. Maybe China. Into COVID nearby disrupted a lot of the supply chain. Into manufacturers they having a lot of back order issues. Into so one you proactive now try my drone san. Maybe a time now here drone na ebi ni ho. Na he say no beko him. Into always try and be proactive. O prescription bottle now more no information be bottle no what you need to pay attention to, right? It tells you how many refills you have left on the bottle. Pharmacy address or bottle ne so. Pharmacy phone number or bottle ne so. Doctor will try drone no ni din and so or bottle ne so. Into o show bottle na ube how many refills aka. Tebe mu who say draw we say na come one refill. It means say me failure next time no. Say man frame a doctor and quality prescription for fra. E be ni ho a o be fill ya mame. Into refills no helps you know when to call your doctor and request for a new prescription. Into people need to pay attention to that. And you need to, the last one I can say, you need to take charge of your own health. I cannot tell you sometimes in Ipaba pharmacy, na ya prescribe a drama na obisano. Then a doctor prescribe a drama or say minim. Maybe me come a doctor on one or do maybe an amanom. Oh yes, sir. Only was near kun at watching.
Yeah.
Until you need to take charge of your health care. And what now say the doctor can't be no, you need to research. These doctors, they are practicing based on clinical guidelines. If you go on Google, if I see a diagnosis of hypertension, if you type hypertension treatment guidelines, it will come. It basically walks you through, say nipano, a blood pressure, a drosing, a debman, and no radia tosono. And this is a walk doctor, or not who fee saying, don't know the man, it doesn't line up with the guidelines, so you have to ask questions. Right?
Maybe I want to see your body moon and said, no, I dream no more.
Yeah. You have to ask questions because these guidelines, they updated from time to time based on the evidence and the research that is coming out. Fanasa Doctor Review School 2023. Within the next 10 years, they will update this guideline based on the new information that is coming out. This old doctor did 60 years, by the time we call medical school no guidelines e reach na de no etwam nti the doctor ni nyu obi a osua de bia no update no ho a they will be treating you based on old guidelines.
Yeah.
And also so what the doctor be bia no manom when be ba also no wo to atwene kwa.
Because I've always had this challenge when I'm choosing like a primary doctor, and I'm like, do I go with age and look out for experience, or go with like, no graduate school, say, or you're fresh out of school, into everything that they know is current, but we need experience. It's always a challenge there.
Yeah. And a very, very important advice. You need to take charge of your own health. You need to do research. You need to ask questions. This men can say, maybe the doctor maybe no. You need to make sure you are playing an active role in your own health. So if we say BB make sense, question it. Okay. Question it.
Now, if I say be or doctor for like so many years, would you advise nipa sano sometimes? Once a doctor, no, say what they've been getting all this while, are you true? Like for second opinion, second review, and I say, let's just stick to one doctor.
Yeah, and a lot of times, there is something that would trigger you for you to decide, say, I do wait there, or say, be I'm a second opinion. And a lot of times, or more research, and are the ones that are able to come to that conclusion because information or no. Every day and answer what Magadan Nas or Hesebia doctor need treating or Timuse, Ebia, and Neman Sadan Kuyesa. And then based on that decision, based on that information, we decide to say, okay, Ebia, my uncle second opinion. But who will be a no answer my corner trauma me, the doctor can be an idea. You will not even know, say, Ebia, you are not being treated right. And a lot of times, people that are active in their own healthcare, those are the people that will question some of these things and then answer Dr. Nebeman. And if they are not convinced, then they will say, let me go seek a second opinion.
Yeah, and it's interesting because, say, Ghana Uncle Hospital, now Dr. Himself say, at the end, a year or not, Dr. Menya malaria. It's like, okay, now, only my diagnosis, I then I feel now, but I say, Ghanaian doctors don't like that at all, but at least. I say it's good to take off your own health, read about stuff, educate yourself. It also helps because sometimes, doctors are also human. There's a lot of things that they learn, and sometimes similar things can get confused. So it's good to sometimes have second opinion because especially with surgeries, it's good to have second opinions because sometimes you might not need it. Sometimes there's another way.
Yeah, absolutely.
And the Chroma says your healthcare is money. This private practice is an idea. So it's always very good to invest in your healthcare, pay very particular attention to your healthcare. All right. Bushan for nene hani ade jumadienu ebesi na eda masepa say weeks abe seen na money ade up to this point now. Information were very good, so very educative. Share with your family, friends. Share this piece. Let everybody see it. Now, and question any pabebre if we say apomudin de ehiapa nipa de. Unye sika mpempem kwa na ni apomuden na akwaye bibia ho onye sika pa na fe kondo fufu a untimi ndi because yare nti yen hwe apomuden ye na yen practice preventive we say so because na drone nya say your natural ones or yen kan ho asem but your synthetic ones all right and then nipa so den ka obenya nka onyare na introduce any additional material into your system. Into preventive measures and cleanliness is next to godliness. You keep your surroundings. You be able to your body move you making sure say a mote na nkofa instance will be amber. The must pass money at same bedrooms same way now. Next week so a better same bed journey and I treat the topic I call your name so. Yamisha Umbebre. Good night.